Welcome to the Illinois Perinatal Quality Collaborative Labor Management Support e-modules. These e-modules were made as a resource to support hospital implementation of the ILPQC Promoting Vaginal Birth, or PVB, initiative. The aim of the PVB initiative is for 70% of Illinois hospitals to be at or below the Healthy People 2030 goal of 23.6% cesarean delivery rate among NTSV, or nulliparous term singleton and vertex births, by December 31st, 2022. Our goals include increasing the percent of C-sections among NTSV births that meet ACOG SMFM criteria for cesarean, as well as educating physicians, midwives, and nurses on ACOG and SMFM criteria for cesarean, including labor management strategies. Hospital quality improvement teams participating in the PVB initiative are working on 5 key strategies to reduce cesareans among NTSV births, including labor management support. ILPQC partnered with Jessica Brumley, the co-creator of the Florida Perinatal Quality Collaborative, or FPQC, labor support workshops, completed by over 400 nurses and providers in Florida as part of FPQC's Promoting Primary Vaginal Deliveries, or PROVIDE initiative. Jessica is Director of Midwifery at the University of South Florida Department of Obstetrics and Gynecology, where she leads a team of 14 midwives and advanced practice nurses. She also serves as an advisor on the FPQC PROVIDE initiative. In August and September of 2021, Jessica and ILPQC worked together to offer 2 live virtual labor management support courses for nurses and providers in Illinois. These sessions were recorded and broken down by topic into this collection of 14 e-modules ranging from 6 to 21 minutes each. We are excited to share them with you. Now I will turn it over to Jessica.
So if a patient is going home, and what are things that you can do, or education points that you should cover with them, right? So what are signs of concerns? Let them know how long latent labor lasts, and what she can do to stay comfortable at home. So all of these strategies, right, that we just talked about, share that with them, give them something to do. They came to the hospital because they thought this is where they needed to be. And so it's important for us to assess what they were doing at home and what they can do at home differently. And then when should you come back, right? So obviously we go over the signs of concern. If these things are happening, then you should come back. But I like to go over, what does active labor feel like, right? So to the laboring person, what does active labor feel like? It's going to stop you in your tracks, right? You're not going to be able to walk or talk during the contraction. You might just put up your hand and kind of breathe through it. And then for the support person, what does active labor look like, right? How serious they get in that focus and really become much more inwardly focused. So making sure that you provide that information to both the patient and the support person. And another tool that we can use when helping patients make a decision is BRAIN. And BRAIN is an acronym for helping patients to think about the benefits, risks, alternatives, their intuition, right? What is their gut telling them? And then what if we do nothing or just need a little bit of time, right? And so at any point during the labor process, when a decision is being made, this is one way that they can implement that sort of process of shared decision making. And so I mentioned that shared decision-making tools would be helpful in this at this point. And this is an example of one from Lamaze. Lamaze has some really great resources. You can go onto their website. I like their graphics. It's colorful. It's something that is available for anyone to use, and they're evidence-based. And so I think they're really good tools for our patients. And this is just, sort of a segment of it, right? So there are several proven benefits, meaning they're, reviewing the evidence on, in this case, continuous labor support. And talk about what they can expect, right? What kind of care they can expect. And since we're talking about communication, I wanted to talk about communication with the care team and how critical that can be. And so at our institution, we're an academic medical center. Everyone's pretty much in-house. And so you have the midwife or the physician who is evaluating directly every patient in triage. But I know that that's not the case at all hospitals, and that in many hospitals, it's the bedside nurse who is evaluating the patient and then reporting to the care provider, who may be at home or in the office and in another location. And sort of, the way that we communicate with each other can influence decisions. And so I thought I'd use an example of a script that is, using SBAR in the way that, many of us have been taught to communicate. And so the SBAR is, right, situation, background, assessment, and recommendation or request. And so in the situation, we explain what's going on. So if I'm the nurse and let's say, I'm calling the provider and I say I'm calling about Ms. Johnson in triage 5. She presents with complaints of contractions every 5 to 7 minutes for 5 hours. Now, what's the clinical background or context? Ms. Johnson is a 32-year-old prima gravida at 39 weeks and 5 days. She's had an uncomplicated pregnancy. She denies leakage of fluid, vaginal bleeding, and reports normal fetal movement. Now, what's your assessment? I performed an exam. She's 3 thick and -2, and her NST is reactive. She seems to be in early labor and is coping well. And so that's, important information to share, especially for someone who isn't actually looking at the patient or present in the room. And then what's your recommendation or request? And this is the part that really, I think, can seal the deal and impact the decision, because I know that in many times that someone who comes in at 39 weeks, even in early labor, if the provider isn't present in the hospital, they may just say, okay, we'll keep her and I'll come and check her later or something. But if you've reviewed the evidence with this individual and their partner and they seem to be doing well, then you need to sort of seal the deal in your communication by making the statement of, I've reviewed comfort measures with her and her partner, and they prefer to go home and come back in active labor. Right, so once the patient has come to that decision, I think it would be hard to sort of deny that request.